BI-RADS 0 on your mammogram report? Take a breath. Big does not mean cancer. And that is the first thing I want you to hear. If you saw this result on your online portal before your doctor called, do not panic. Many digital systems now release reports automatically before the medical team has had time to explain the next step. One of the most common questions patients ask is, "Doctor, does this mean you found cancer, but you are not sure yet?" No, the BI-RADS 0 meaning is much simpler. It means your mammogram is not complete yet. The radiologist needs a little more information before giving the final result. So if you were called back after mammogram screening, that does not automatically mean bad news. It usually means the first test raised a question that needs a closer look. In fact, callbacks are common. Most women who are called back after a screening mammogram do not end up having breast cancer. That is why an incomplete mammogram result should not be confused with a cancer diagnosis. If this is your first time seeing a medical report like this, press like. So this video can reach other women who are feeling worried right now. Another question we hear all the time is BI-RADS 0 a bad score? Not really. A BI-RADS 0 mammogram is not a final category, like BI-RADS 1 or BI-RADS 2. It is a temporary category. It means the screening images were not enough on their own to give the final answer. Patients also ask, if my last mammogram was normal, why is this one BI-RADS 0? That is a very reasonable question. Breast tissue can look different from year to year. Sometimes a tiny area looks more noticeable on one image, and the radiologist wants extra views to decide whether it is just normal tissue overlap or a true finding. So, yes, you can have a normal mammogram 1 year and still be called back after mammogram screening the next year. Some patients worry that the scan was done wrongly. Usually, no. An incomplete mammogram result usually does not mean the technologist made a mistake. It usually means the screening mammogram did its job by flagging an area that needs a second look before the final category is assigned. Now let's talk about one important reason this happens. Dense breast tissue. A dense breast's mammogram callback is common because dense tissue can make mammograms harder to read. Dense tissue and some abnormalities can both look white on the image, so the radiologist may need extra views to separate normal tissue from something that needs more attention. So, if you have dense breasts and now have a dense breasts mammogram callback, that still does not mean cancer. It often means the tissue is simply harder to assess clearly on the first screening exam. Another common reason for BI-RADS 0 is tissue overlap. Sometimes normal breast tissue overlaps on a two-dimensional mammogram and creates the appearance of a thicker area or a shadow on the first set of images that can look unclear. So the radiologist may give a BI-RADS 0 mammogram result and ask for more pictures. Once those extra images are taken, that area may turn out to be only normal overlapping tissue. We also hear concerns about asymmetry. That word sounds worrying, but it often just means one area looks more noticeable than expected on the screening images. Sometimes it is completely benign. Sometimes it is just overlap or positioning. That is exactly why patients are often called back after mammogram screening. Some patients also ask whether deodorant, powder, or lotion can affect the images. Sometimes, yes. These products can occasionally leave tiny marks or artifacts that make interpretation less clear. That is why imaging centers often tell patients not to apply them before the test. Now here is another key point. Old mammograms are extremely important. If your previous imaging was done somewhere else, the radiologist may want those older studies for comparison. And this can make a huge difference. Stability over time is one of the most reassuring things we can see in breast imaging. If an area has looked the same for years, that strongly supports a benign explanation. Sometimes a patient is called back after mammogram screening, simply because the radiologist does not yet have the earlier images. Once those older films arrive, the incomplete mammogram result may be resolved very quickly. This also explains why first mammograms often lead to more callbacks. If this is your first screening mammogram, there are no prior images to compare with. Without a baseline, the radiologist has to be more cautious. So yes, a BI-RADS 0 mammogram can happen more often on a first mammogram, and that is very common. Now let's address the question many patients are afraid to ask. Will I need a biopsy? Not necessarily. A BI-RADS 0 mammogram does not automatically mean biopsy. Most patients first need only more imaging. The BI-RADS 0 meaning is that the screening exam is incomplete. Not that a biopsy decision has already been made. Most people who are called back after a mammogram screening do not end up having breast cancer. So, what usually happens next? After a BI-RADS 0 mammogram, the next step is usually more focused imaging. That may include extra mammogram views, ultrasound, prior comparison, or a combination of these. The goal is simple: to turn the incomplete mammogram result into a final, clear answer. Patients also ask whether they can just have an ultrasound instead. Sometimes ultrasound is very helpful, and sometimes extra mammogram views are more important. These tests often work together. The right next step depends on what the radiologist is trying to clarify. And that is why being called back after mammogram screening should be seen as part of the evaluation process, not as proof that something dangerous has already been found. So let me leave you with the key message again. BI-RADS 0 means the mammogram is not complete yet. That is the real BI-RADS 0 meaning. It does not mean cancer. It does not mean the worst has been confirmed. It means the radiologist needs a clearer look before giving the final result. So if you have received a BI-RADS 0 mammogram report, try not to panic. If you were called back after mammogram screening, remember that this is common. If you have dense breast tissue, a dense breasts mammogram callback is also common. And an incomplete mammogram result is often just one step on the way to a final reassuring answer. If this helped you understand your report more clearly, subscribe to Dr. R.J. Health. And if you know someone who has just been called back after mammogram screening, share this video with them. It may help them feel calmer before the follow-up appointment.